We'll address a condition, and this is like in embryology of the females, right? So as the female child is developing, you can have this issue coming up. So there could be absent canalization of the vaginal plate, or there could be incomplete canalization of the vaginal plate. Okay, so for either one of them is an abnormality, so of course they should come up with issues. Okay, so let's look at it and the issues that could actually be there. So you can see the vaginal plate, so later a canal is formed in it, so that's what we call canalization. So if there's absent or incomplete canalization, what could be the issues that could come up? So it just refers to what a developmental anomaly when the girl child is developing. Okay, so we call that the congenital vaginal abnormalities. Okay, somebody was born with it. So the vaginal plate forms from the sinovaginal bulbs. Can I say it? Sinovaginal bulbs. All right. So canalization is a process of forming a hollow tube, like a canal is formed, a passage is formed. Okay, so this process is typically completed by the 5th week of gestation. So now let's talk about if this process is not completed. So what happens when the canalization fails? So that's when you have issues like vaginal agenesis, vaginal hypoplasia, that's a short or underdeveloped vagina, transvaginal septum. You have like here, like this, like the way this place is clear. But for transvaginal septum, you have things coming from this side to attach on this side. Okay, so kind of like partially blocking the vagina. Imperforate hymen. This is when the hymen fails to open. So when the girl starts menstruating, the menstrual blood will accumulate. Something is blocking it from coming out. Okay, so clinical presentation, they can present with no menstruation, pelvic pain, or hematocorpus. That's accumulation of menstrual blood. There could be normal external genitalia. Okay, so you now see the outside is normal, so this can now make you to now think, this person doesn't have issue, but initially they actually have an issue. So treatment options, imaging, you can image to see the inside, and that's basically diagnosis, right? So surgical intervention is basically you are trying to remove any obstruction. You are trying to actually still create a vaginal canal that is very normal. Okay, so that's this process and issues that could come up if the process is absent or incomplete.